Yesterday I saw a cria here in the clinic that had a congenital defect known as choanal Atresia. I'd just like to spend a few minutes sharing the details of this clinical case with you so that you might be aware of the clinical problem that might sometimes crop up in your crias so that you can spot it and you can help your vets understand what the defect is and how to look out for it and diagnose it in those cases. Choanal Atresia is a congenital defect. That means present at birth, so congenital means present at birth. It is also thought to be a genetic defect based on some of the research that has been done out in the US that shows that it is an inherited problem. We're not entirely sure what the mode of inheritance is, but we believe that there is a component of genetics that comes both from the dam and the sire to cause the defect. Now, choanal Atresia is a defect that crops up in about 1 in 30,000 human babies, and we also see it in camelid babies, but otherwise it's not particularly well known in the veterinary world because it's really very rare in veterinary species other than our camelid patients. Now, what is choanal Atresia? Essentially, during embryological development, so during the fetal development within the uterus of the mother, there is development of all these various bits and pieces within the cria's body. And part of that development process means that at the back of the nose, there's a hole, or should be a hole, that develops called the choana. So that is essentially right at the back of the nose where the nose joins the nasopharynx and then the nasopharynx joins the back of the mouth, which is known as the oropharynx. And in choanal Atresia, where those holes are supposed to be, the holes fail to develop. So instead of developing holes, they just continue to have an obstruction at the back of the nose. What that means is that a cria who wants to breathe through its nostrils and through its nose can't breathe through its nose, it can only breathe through its mouth. And that is a defect that they're born with. Most of the defects that I have seen in crias have been membranous defects, meaning that it's just a soft tissue defect, although out in the west of the USA, it seemed to be more common for these crias to be found with bony defects. The bony defects were, people tried to do surgery on those. They had a lot of complications. Things didn't go very well. Back 20 years ago or so, during my residency, we did do some surgeries on the membranous defects. We wouldn't operate on bony defects if we found that they were bony. But if they had membranous defects, you can do a surgery, but they need to be under general anesthetic and intubated to protect their airway because we do cause potentially a lot of bleeding in the area. However, it has been shown since that time that the defect choanal Atresia, there is like a genetic complex of defects that are associated with it. So it's not just a genetic defect of choanal Atresia that they typically have, they do have other defects as well. Combined with the knowledge that most of these crias fail to nurse well during the first 24 hours of life, which means they don't get sufficient colostrum, which means that they have failure of passive transfer, which means they often will develop sepsis and need to have a plasma transfusion, antibiotics, and quite a lot of care during the first week of life. These crias are, not great patients. And by the time we reach that diagnosis of choanal Atresia, they're possibly already going down that path of failure of passive transfer and developing sepsis. So with a genetic defect, an animal that's not going to be bred, you shouldn't be breeding these animals because they could pass that defect on to their offspring, and the potential amount of expense associated with trying to correct a defect and bring the animal back around, you're looking at potentially quite a lot of money for an animal that you're not going to be able to generate an income from in terms of breeding later on. Now, if that was the only consideration, that would be one thing. However, there is a welfare and ethical issue associated with correcting these defects as well. And so what that means is that our usual advice to you as an owner is that these are crias that unfortunately we would recommend you euthanize once the diagnosis is made. So you're probably thinking, what would you see or what would you expect to see in a cria that is suffering from choanal atresia? Well, once the cria is born, it probably looks fairly normal in terms of its appearance. You're not going to see anything obvious externally. However, you might notice if you look closely that the cria is breathing a little bit differently. And what you'll most commonly see is a cria that's puffing out its cheeks. Its nostrils will also be flaring so that it looks like they're clearing air through their noses, but they're actually not. And if you were to take a little piece of cotton wool and put it in front of each nostril separately, very carefully, so that you're not actually blowing air from the mouth, you need to have it carefully in front of each nostril. There's no airflow from that. There's a better test that I'll tell you about that we can do. But they are breathing through their mouths, they're puffing out their cheeks, and the reason they're puffing out their cheeks is because they're trying to squeeze air from their cheeks over the epiglottis to be breathed, essentially. So they fill their cheeks with air, then they close their mouth, they squeeze their cheeks, and the air is sort of forced backwards down the trachea and the esophagus. So what happens if they survive over a period of a couple of days or so is that they're swallowing a lot of air, so they end up with a bit of a gassy feeling tummy. So cheeks puffing out most of the time. The cria that we saw yesterday was quite interesting, as you'll see in the video that the owner very kindly allowed us to share with you, was that cria had an upper respiratory tract noise that it was making, but it wasn't puffing out its cheeks. So it made it slightly less normal case, in terms of the typical presentation. This cria had quite a pronounced noise that it was making. When I listened to the chest, I could hear a lot of that referred noise over the chest, but the chest sounds, when it stopped making the noise, were actually quite clear. And I think the vet who had seen it previously thought that the lung sounds were fluidy, but in fact that was just referred upper respiratory tract noise that you could hear, and when it stopped making the noise periodically, you could hear nice clear chest sounds. The cria that you'll see in the video was also quite sleepy, quite quiet, sat on the table. So it was about 24 hours plus 6 hours, so about 30 hours of age at the time we saw it. So it was already starting to develop clinical signs of failure of passive transfer and impending sepsis. The temperature was normal, but we did have fairly bright red looking mucous membranes as well. So I think we had some other problems coming into play as well. So I'll show you those videos next, and you can see how the cria appeared to be breathing. And the video that I'll show you after that is how we make the diagnosis of choanal atresia. And there certainly can be more complicated ways of diagnosing these cases, but I simply use a soft rubber catheter, and I pass that down the ventral nose. So there's only really one passageway to the back of the nose, but there is also a little dorsal diverticulum, and that's a blind ending area which is shorter than the nose passageway. So if you pass a catheter in a bit too high up, it'll get stuck and it'll be shorter than where you find an obstruction at the choana if you pass it all the way back to the choana itself. And when you get that obstruction, you'll see me pull a tube out and line it up on the outside of the face. And the length of that tube, if the tube is only going so far as the choana, that will line up with the inner eyelid or the inner corner of the eye. And that is where the choana sits, inside the nose itself. So we know that if we have a repeatable obstruction at the level of the choana, we know that that's choanal atresia, and we would usually recommend euthanasia. Libby.
You always want to make sure that you angle the tube down, because there is a little pocket that the tube can get stuck in, a little diverticulum at the top. And if you get a repeatable obstruction that goes to the level of the medial canthus or inner eye, that is fairly consistent with choanal atresia. Okay. Yeah.
One of the things to be aware of when you're working with crias is that there's fairly limited possibilities of things that can be going wrong in the first few days of life. So we can see an animal that is hypothermic. Okay, so it's been born into inclement weather conditions, it's cold, it needs warming up. It can then have some other issues as well, such as hypoglycaemia. So let's say this is a cria that has not been nursing, that animal is going to be hypoglycemic because it hasn't been taking on milk, and then its blood glucose levels that it's born with certainly start to slide, and then you'll see a cria that's not doing very well from hypoglycemia. So that's issue number 2. Then we can move into ruling out congenital defects. So like the one we showed you in this video with choanal atresia, there can be a number of other congenital defects that do need to be ruled out. Heart defects, the more obvious facial defects of deformities, limb defects that probably aren't going to be an issue for the animal in terms of its ability to live, but that are more obvious deformities that can be spotted. So we're trying to rule out things. When we see as a vet, when we're seeing a newborn cria that's having problems, we're trying to rule out these various problems. So the hypothermia, hypoglycemia, a congenital defect that perhaps isn't obvious from the outside of the animal, and finally then failure of passive transfer, sepsis, and all of the potential versions of that and degrees of seriousness with failure of passive transfer and sepsis and all the things we have to do to address it. So if we are going to proceed with treating failure of passive transfer and sepsis, we want to make sure that we have a normal cria that is going to be able to recover normally. If it's got a congenital heart defect, for example, with a loud murmur, then there's probably little point in spending all that time, energy, and effort and resources like using your valuable plasma to correct failure of passive transfer if it's actually not going to recover. So we do need to rule out those simple things before we start going down the line of treating failure of passive transfer. And in this case, as you can see, we found a defect. We were able to advise the owner appropriately in terms of how to manage that case, and unfortunately, we had to advise euthanasia. But that meant that she wasn't spending the next few days trying to work with a cria that actually was going to not do very well down the line.